Good morning. Pleasure to be here. In fact, it's an honor to be here, certainly following my three colleagues. When I heard that I was actually going to be following Dr. Cortese, it reminded me of a story I'd heard a while ago about a man who would survive the Johnstown floods. Johnstown floods in the 1800s in Pennsylvania. At that point, it was the worst natural disaster in American history. It killed about 3,000 people, and this gentleman had survived. Harrowing tale, loved to tell everybody about it. And so he lived to a very old age, finally died, and when he got to heaven, St. Peter welcomed him and asked him if there was anything he could do for him, and the man said, "Yes, I would like to hold court and tell people about my experience surviving the Johnstown floods." So St. Peter said, "Okay, I'll check on it. I'll get back to you in a few minutes." Went, made arrangements, came back, said, "Hey, good news. We arranged for you to be on cloud C3, which in this room might be over in that corner, I think." Said, "But I do want to let you know that Noah will be in the audience." And so when I figured that I was following Dr. Cortese, I thought, holy smokes, Noah's going to be speaking before me? But it is a pleasure to be here, and I actually think that what Dr. Cortese outlined and how it relates to the discussions that are happening back east is very, very important because, as you know, if you've been following the discussions, which I'm sure everyone has, very contentious. And in fact, there was a poll I was going to read to you this morning. I just got this while we were waiting. This is a new Washington Post ABC poll that says America is not satisfied with the direction of these discussions. And I think it's because, in my mind, that they missed the point, or the Congress is missing the point on what Dr. Teesberg and Dr. Cortese and many others have said, that these plans simply missed the mark. So from the Washington Post ABC poll this morning, nearly half of all Americans, 45%, say that the reform plan would create too much government involvement in the system, a number on par with polls taken in 1993-94. Two-thirds think that the reform plan would increase the federal budget on the crucial question of what's in it for me. Twice as many Americans, 32 to 16, think it will make their own care worse off. More than 3 times as many, 37 to 11, think it will hurt their coverage, and twice as many, 40 to 20, think it will increase their costs. Increase their costs. Now remember, in the campaign trail, the president was talking about saving the average American family $2,500 a year. And now, by a stretch of 2 to 1, Americans are repudiating that promise. And the president, if you notice, has not talked about that promise very much recently. The quip that we've come up with is, it's hard to save $2,500 per family per year when you're spending another $1 trillion. And I think the public is starting to get to understand that. But there is a way to solve this problem, and I agree with everything that's been said this morning. My boss, Speaker Gingrich, founded our group back in 2002 to really transform the system. So he's not a Johnny-come-lately to this. He's been studying this for a long, long time. He's been a fan of Mayo and Intermountain. We do work with Intermountain on a number of things. So there are things that are actually working, but there is so much improvement that could be done. And we think there's a way to do that. So the president, I think, did the first step the other day was when he gave his speech before the Congress. We thought it was a good opportunity for him to take stock of what's happened over the last several months, particularly in August, and try and recalibrate, as he might say, the discussion and the approach. Unfortunately, what he did was to recite where they've gone and the path that they're heading, to basically double down on that and really commit to going down the same path of where they've been heading. What he did, though, he was trying to calm the troops. It reminded me a little bit of this gentleman. I don't know if anyone remembers the movie of Animal House. This guy was at the end, this is Kevin Bacon, he was at the end saying, "Remain calm, all is well," which is what the president was trying to do, particularly within the Democratic Party. So what we think he could actually, what he should have done, and what there is still time to do, is to actually repackage a policy approach that can accomplish what Dr. Cortese and many others have talked about: reducing costs the right way, increasing access, increasing coverage, and most importantly, I think, improving quality. Because if you don't have good quality, which affects everybody, whether you have insurance or whether you don't. You're simply building a foundation. You're basically building the foundation on quicksand if you simply expand coverage and do nothing, as Dr. Teesberg said, to improve the delivery system. So here are 5 things that we think the President and the Congress should actually do at this point, because judging by the public's reaction and even the experts in the industry who look at the packages and try and sense where they're going and what the impact might be, we think there are 5 things. First, it starts with improving the quality of the care that's delivered. I think that's absolutely number one, because as the President said, and he's absolutely right, there is enough waste, there is enough inefficiency in the system that you can do a remarkable amount of change to improve the delivery of the system, which therefore increases the quality of the care that you get. So there are things like coordinated care. I mean, all the things that were mentioned this morning could be in a legislative package very easily, and I think enjoy wide bipartisan support. Everyone would be for these things. Payment reform. In fact, what we're trying to do, we have a meeting on Friday, as a matter of fact. We're kicking off an initiative at the center where Speaker Gingrich and Senator Daschle are actually co-chairing an effort on payment reform. This is much like, as Dr. Cortese knows, the American Medical Group Association had about a 2-year investigation into how to reform the payment system. We've done a lot of work with AMGA, so they'll certainly be part of that. So, improving the delivery of care can save a lot of money. Secondly, wide bipartisan support, or at least wide public support, reforming the liability system. Did you know that in more than half the states, it is actually illegal, or not, excuse me, not illegal. In more than half the states, if something occurs, medical error, complication, something occurs to compromise a patient's safety, in more than half the states, a physician cannot say, "I'm sorry," without having that be admissible as an admission of guilt in a court of law. Can't even say, "I'm sorry." So when you think of health courts, specialized health courts, when you think of liability protections for physicians and hospitals that actually follow clinical guidelines, use best practices, use electronic health records or other technology, if they do it right, they should get some liability protection. Absolutely. And then lastly, the most controversial part is caps on damages. And that's certainly something that is very controversial within the Democratic caucus, but enjoys wide support in the public, and certainly physicians agree with it as well. But I think that by splitting these things up into 5 parts, you could actually get these done. Third, insurance reforms. If you just take what the insurance industry has actually put on the table proactively, you could pass it in a single day, I have no doubt. Last December, AHIP, which, since a full disclosure, I used to work at AHIP, the Trade Association for Health Insurance Companies, put on the table a package of, we will guarantee issue. We will give everybody a policy who comes and applies for a policy. We will do no underwriting based on health status. We will cover pre-existing conditions. We will accept a federal minimum benefit set mandated by the federal government in all of our policies. We will accept an insurance exchange that will be both regulatory and a transparency portal. They put on the table all of those things. You don't hear much about them being that proactive, but they did. If you just take what they've proposed and put it in a bill, it would pass with huge majorities. Fourth, saving Medicare from bankruptcy. Medicare, as you know, is going to go broke in 2017. Trustees' report came out this spring that said so. That's actually, I think, a year or 2 earlier than last year's report. Beyond that, for future generations, Medicare is already, right now, $36 trillion in the red. We have promised $36 trillion in benefits, and we haven't saved a penny. So by doing nothing, it's beyond unsustainable. But the bills in Congress actually don't do anything for the long-term solvency of the program. They actually use what the savings that they generate to pay for other things, like tax credits and subsidies and the exchange and the public option. They don't do anything to actually help the Medicare program. So we think that health reform has to address the long-term solvency of Medicare. there was actually, one thing I'll mention, there was a report about 10 years ago, the National Bipartisan Commission on the Future of Medicare, chaired by John Breaux and Bill Thomas, that President Clinton commissioned. It came up with 10 fairly controversial, I'll admit, proposals, but it was a very bipartisan approach, and just dusting that off would be a good starting point. Lastly, I wanted to point to something that Dr. Cortese said about individualized medicine. Encouraging and promoting innovation in healthcare. Innovation in science and research is absolutely essential. The bills going forth right now are virtually silent on this issue. There's no reform of FDA. It costs $1 billion to bring a drug to market, and there's only about a 30% chance of whether that drug actually earns its money back. But $1 billion to bring a new drug to the market, mainly because of the process that drug manufacturers have to go through. But there's nothing in there that actually encourages innovation. In fact, in the Senate Finance Committee, it actually punishes innovation. We call it an innovation tax because they're taxing device manufacturers, they're taxing pharmaceutical manufacturers to pay for, again, subsidies, to pay for the exchange, to pay for the public option, to pay for the plan. They are punishing the innovators, which we think is the exact opposite of the approach you should take. And I think if you could find cures for things like Alzheimer's, Newt actually co-chaired with Senator Bob Kerrey from Nebraska an Alzheimer's study group, had Dr. McClellan and Dr. Satcher, former Surgeon General, Justice O'Connor. Just by solving Alzheimer's alone will save an estimated $20 trillion over the next 75 years. Just for Alzheimer's, Medicare is going to pay $20 trillion because of the devastating effects, because it's a disease that takes so long to treat. And there's no cure at this point. But by solving that with science, we think that you could just bust open the doors on all kinds of innovations. So with that, I think that the President and the Congress have an opportunity to really take that approach, break these bills up into individual bite-sized pieces, and they could enjoy, I think, a swift victory that the American people would actually support. If they don't, they may run into trouble. In fact, the last thing I'll leave you with is when he's screaming, "Remain calm, all is well." If they don't take this kind of approach, they run the risk of actually living what happens in this movie. So we have a video clip, 20 seconds, so it'll give you a laugh, and I think end on a note where this is very, very serious, but at the same time, there is a right way to do it. This is kind of like the August recess, I think.
Remain.
So let's hope that doesn't happen. Let's hope that we can actually get this right, and we think by breaking it out, they can really hit the mark and really improve quality and set the stage for really a transformation of the system. So with that, thank you very much.